Good morning. We're still going to have people probably trickling in, but we're going to go ahead and get started. Thank you, everybody, for attending in person and all of our attendees online. On behalf of the League of Women Voters of Pennsylvania, welcome to the 11th Annual Shale and Public Health Conference. I'm Chris Beuger of the League of Women Voters of Greater Pittsburgh, and I will be your MC for the day. The Shale and Public Health Conference is hosted by the University of Pittsburgh's Graduate School of Public Health. This is the first time we are back in person at the University Club since the start of the pandemic. This year, however, we were having a hybrid conference with both in-person and virtual attendees. The conference will run from 9 to 4 with short breaks in the morning and the afternoon. From noon to 12:20, we will break for lunch. At lunch, there will be a speaker from 12 to 12:50, and then a short break before our afternoon presentations begin at 1. Before we begin this morning, there are many people that we would like to thank for making this hybrid conference happen. Thank you especially to Heather Haar of the League of Women Voters of Pennsylvania's Citizens Education Fund for her annual coordination of this event. We would not be here if it was not for her. Thank you to the Pitt Graduate School of Public Health for continuing to host the conference, and to James Ferris, who is handling all the technical issues to ensure that you can participate in today's conference, whether you're in the room or connecting via Zoom. Thank you to all the Pitt staff who have worked behind the scenes to make this possible, and to all the wonderful volunteers who have stepped in to make this conference run smoothly. Lastly, most important of all, thank you to our speakers and to all of you attending this conference. We have a tightly packed schedule today covering many different topics related to shale gas and health. In order to save a little time, we will not be reading speakers' bios. The agenda and biography information about each speaker is available on the League of Women Voters Shale and Public Health website. The link is provided in the chat for virtual attendees, and when you follow the link, please page down to see the information. Program booklets are provided on your table for those that are here in person. There will be a question and answer period after each section. We will try to get through as many questions as possible. We will be accepting questions through the chat for virtual attendees and questions written on note cards for in-person attendees. Note cards are provided on your table. If you need more, there will be volunteers with extras. Hold up your question card and a volunteer will come around and collect it. You can submit questions anytime during the presentations and during the question and answer. If possible, note which speaker you are asking the question to. A friendly reminder for virtual attendees, please keep your mics muted, especially during presentations. If you forget to do that, our technical producer will mute you. And for in-person attendees, remember to visit the exhibitors that are located around the perimeter of the room during our breaks. After the conference, we will ask you to fill out our conference evaluation. The link will be posted in the chat throughout the day. These evaluations help us plan for future conferences, so please take a few minutes to fill that out. We are recording today's conference. You will receive information from the League about accessing these recordings once they have been posted on the League's Shale and Public Health website, which will be and it will also be in the chat. This year's Shale and Public Health Conference is made possible with the funding from the Heinz Endowments to the League of Women Voters Pennsylvania Citizen Education Fund. Now, I'd like to introduce Sam Anthony, Program Manager at the League of Women Voters of Pennsylvania. And she is virtual. Sam?
Good morning, everyone. Welcome to the 11th Annual Shale and Public Health Conference. My name is Sam Anthony, and I am the Program Manager for the League of Women Voters of Pennsylvania. I'd like to again thank our conference organizers, in particular Heather Haar and Debbie Larson, for their work on this initiative. I would also like to again thank the Heinz Endowment, whose generosity allows this conference and this important information to be free and open to the public. The League of Women Voters of Pennsylvania encourages informed and active participation in government, works to increase understanding of major public policy issues, and influences public policy through education and advocacy. The League does not support or oppose any political party or candidate, but does take, and has always taken, stands on issues its members have studied. Through a rigorous study and consensus-taking process, which is initiated by our grassroots membership across PA, we take positions on governmental, social, and environmental issues. Through research and advocacy, the League seeks to encourage Pennsylvanians to actively participate in government. Over 10 years ago, the League started our educational project, The Straight Scoop on Shale Drilling. Its purpose is to educate and engage the public regarding natural gas extraction from Marcellus Shale. As part of this commitment, the Straight Scoop on Shale Drilling organizes our annual conference featuring a large variety of experts speaking on topics related to shale drilling. This annual conference is one of the proudest accomplishments of the League. We are thrilled to bring together experts from around the country on this timely topic, many of whom you will hear from today. At a time when our state and our country have become increasingly polarized, events like this conference allow us to come together to hear and learn from subject matter experts and to make informed decisions when it comes to how we advocate and how we vote. Thank you for joining us today, and please enjoy the wealth of speakers and information that you'll receive. If you're interested in diving deeper into the environmental work of the LWV, please consider joining as a member or giving the gift of membership to an advocate in your life. You can join by visiting our website, palwv.org. Thank you so much, and please enjoy the event.
Thank you, Sam. And now I'd like to introduce Dr. Sally Wenzel, Chair of the University of Pittsburgh's Graduate School of Public Health's Department of Environmental and Occupational Health, who will be delivering our opening remarks. Dr. Wenzel?
Thank you very much. It certainly is a pleasure to be here again. This is, I think, my 5th or 6th year now of opening the conference. And as chair of the Department of Environmental and Occupational Health in the School of Public Health, we actually have dropped the graduate part of the name because we're now teaching undergraduates about public health. I'm delighted to again welcome you to the 11th annual conference on shale and natural gas development. I'm delighted that the name has been changed from unconventional natural gas to shale because it's much easier to say. And that's part, of course, of the long-standing initiative of the Straight Scoop on Shale. I think it's important for me to, again, thank the League of Women Voters for their involvement in this project. Again, they've been behind this for 11 years, which is a very long time. This conference would not happen without their unswerving support of the conference. And let me say that Heather Haar has been truly a driving force in making this conference happen, and we want to recognize her, as well as Deborah Larson. But I think it's also important to take a bigger picture of the League of Women Voters, again, established about 100 years ago, and since that time has spent an enormous amount of effort in preserving the integrity and the safety of our elections. This conference always occurs about a week after Election Day. 2023's elections went without any hitches. But we know 2024 is coming up, and I think it's very important that we recognize the wonderful work that the League of Women Voters has done and continues to do to ensure the integrity of our elections. So thank you very much from all of us. But getting back to the topic of the day, the League of Women Voters has always, I think, championed the concept of civil discourse in controversial topics, not the least of which is, of course, shale gas and the fracking industry that goes along with it. And it's controversial because of its impact on the economics and because of its impact on the clinical, human, public health of the regions which it affects. I think the support from the League of Women Voters started very much locally here in Indiana, in the Indiana chapter, and then transferred to the Pittsburgh chapter very shortly thereafter. I think it's important to recognize that the League of Women Voters has done everything possible to keep this a nonpartisan effort. Certainly many of the original conferences included representatives from industry. Don't think that's happened quite so much recently because I think of some of the emerging data, but certainly there were efforts to involve people from industry very early on. I think it's important to realize that these issues impact us here tremendously across the United States, not just in Pennsylvania, but certainly here specifically in Pennsylvania. Although shale and natural gas have been going on in this region for about 20 years, we still don't understand lots and lots about the process to drill the wells, to produce the gas, what happens when you leave the wells behind, et cetera. Certainly the regions of Pennsylvania that are impacted continue, I think, to struggle with understanding this balance of the economy, the economic health, and the public health of the region. And I have to say, you know, based on the way at least the spin goes sometimes, it seems sometimes that the economic health, it tips more to the economic health than it does to the environmental and the public health. And these are messages from the constituency of the people that live there. And sometimes when you live in an economically struggling region and someone gives you something that might improve your economy, that seems like a shining light on the hill that you go after and damn the consequences. So I think it's important that we remember that. Because of these economic benefits, fracking is not going to go away anytime soon. It's clearly supported by people across the political spectrum, and I think it's really almost difficult to challenge the potential impact of the economy of the industry of fracking. So there's a tough hill to climb here. I think the economic focus of the shale industry and its impact on the region has really almost made it difficult to collect appropriate data to understand and answer the questions of whether it is possible to develop shale gas both safely and locally, both locally and globally, while still accruing the economic benefits. In fact, we are still in the early days and we need more data. So we're hopeful that the Commonwealth of Pennsylvania and its political caretakers will increasingly recognize the importance of generating data from well-done studies to allow the citizens to responsibly weigh in on the future of the industry. In fact, since our last conference, I'm delighted to say that the Pennsylvania Department of Health, working with the University of Pittsburgh School of Public Health, completed a study on the health impact of fracking here in Western Pennsylvania. We at the University of Pittsburgh were very pleased and delighted to be part of that process. And although the presentation of the data may have been a little delayed from some people's perspective, I think it really was to rigorously analyze the data and to make certain that all of us were willing to stand on the results as they were presented. Some elements of the findings from these studies will be, in fact, presented here today, I'm very happy to say, from both representatives from the University of Pittsburgh, but also from the Pennsylvania Department of Health. Unfortunately, the main authors of the study were obligated to another meeting at the American Public Health Association in Atlanta, which, of course, this date was picked out years ago, and so they really didn't have a choice, and they're there and not here. But we're very hopeful that we will be able to continue the discussions on this important work that has been completed, as well as have more discussions next year with maybe a larger presentation. And of course, we also look forward to seeing the peer-reviewed publications that will arise from these studies. Suffice it to say, we're hopeful that these results will lead to additional support for studies that will allow us to more granularly understand the reasons for some of these changes. Why do we see these health effects from the fracking pads on asthma attacks and other aspects that will lead us to be able to develop mitigation effects that might decrease some of those side effects. In addition to these initial discussions on the fracking studies that were done by the University of Pittsburgh and the Pennsylvania Department of Health, the rest of the conference will focus on additional health impacts, on the toxicology related to some of the wastes, radioactive waste, the groundwater contaminations, as well as the impact of the environment on the abandoned wells, which of course are becoming increasingly common in the region. But I'm delighted to say that the conference will end with a session on alternative energy sources, specifically hydrogen-based energy as a possible long-term solution to our dependency on fossil fuels, which of course is becoming increasingly urgent in our era of climate change. While the direct health impact of fracking and shale gas is still evolving, the long-term impact of the fossil fuel industry to the rapid progression of climate change is increasingly clear and should not be dismissed. Of course, despite the many efforts to develop alternative sources, we still remain highly dependent on fossil fuels for our energy sources. And although we don't commonly think about it, we also remain highly dependent on fossil fuels for the development of plastic. Looking around the room, seeing we're pretty good here. I don't see a lot of plastic water bottles or plastic soda bottles, et cetera, but all of those plastic water bottles and all of those plastic soda bottles come from from the oil and gas industry. I won't say natural gas, but they all come from the oil and gas industry. And here at the University of Pittsburgh, where we do a tremendous amount of medical research, we use plastics in everything that we do in the research laboratory. So we're heavily dependent on the oil and gas industry for the plastic industry as well. And so it's not surprising to me that when you have a lot of natural gas being produced in this region, that the oil and gas companies would be investing in ways to use that natural gas in the local region. And of course, one of the places that they have invested in is building of a cracker plant in Beaver County, which I'm sure many of you are aware of. This cracker plant uses natural gas to crack ethane into ethylene for the development of various plastics. The health impacts of this large investment in Beaver County are still unclear. Certainly it is emitting a lot of VOCs and other chemicals and has exceeded its emissions thresholds in many, many occasions already. But again, we don't understand exactly what the health impacts of this the enormous cracker plant will be on the community surrounding it. The University of Pittsburgh is actively involved in understanding the health impact on the general health as well as the respiratory health of the population near the cracker plant. And I'm excited to be part of some of those initiatives. My background is as a pulmonologist. I've taken care of asthma patients all of my life, and the environment is very, very critical to asthma and asthma symptomatology. I think it's very clear that when the environment changes, people with asthma have problems. And so, at least from my perspective, asthma is indeed a canary in the coal mine type of disease. So that if you see an effect on asthma, asthma exacerbations, asthma severity, you should pay attention to what's going on in the environment, because there certainly could be something there that not only will impact asthma in the short term, but could impact other health outcomes longer term. So yet, as I began, economics are going to play a role here as well, right? There's continuing to be the clash of health and the economy in the cracking industry as well. I think early results from a survey that one of our speakers here today has been part of at the University of Pittsburgh, of general health questions, general economic questions, really suggest that many of the residents living in Beaver County are more interested in the economics of the region than the public health aspects of new industries to the region. We must listen to our constituencies. We must be community engaged in all aspects of education. And it sometimes is a pretty steep hill that we'll have to climb. But again, I think maybe the people in the room, although we're a very vocal bunch of people, we're often in the minority of people, and we have to understand and develop ways to spread the message more. And of course, one of that means that you've got to have solid data to stand on, right? You've got to have solid data that says, in addition to those emissions being high, that it's going to have an impact on your health. It's going to have an impact on your children's asthma. It's going to have an impact on whatever, long term. And so therefore, I think we really have to uphold the values of science, facts, science-based facts, and evidence-based conclusions. Indisputable evidence may not yet exist for the outcomes, the health outcomes in regarding clinical and public health for many of these industries, but the short-term impact on the economy does, in fact, remain clear. I think if we take any messages home from COVID, COVID was an incredibly disruptive time in our lives, and there was a constant struggle between what is economically feasible and what is best for the public health. There were challenges there. There's going to be challenges there in other environmental exposures beyond COVID, including shale and the fracking and the cracking industries. And in an ideal world, I think we should aspire to not only having improvements in the economy, but improvements in the public health as well. And we need to work to that end. So I look forward to an interesting and productive day of presentations, discussions, and moving forward together in our understanding. And once again, thank you to the League of Women Voters to leading us in this process.